Everyone. I just figured I would record these lectures for you so that you can review them and then we can um, talk about it in class and prepare for your exams. So Module 7, we're going through exemplars A, B, and C. The first one, physical fitness and exercise, is exemplar 7A, just health promotion. Wellness, being a state of well-being. Well-being is positive rather than a neutral state. Um, Health promotion, process of enabling people to increase control over and to improve their health. To me, health promotion, health primary prevention are the hugest jobs, roles of a nurse to teach people about things that they can have control over many aspects of their health, and they can prevent a lot of complications from possible disease processes. Okay. So Healthy People 2020, I think I talked about them briefly in class. The goals are reducing the adults. These are some of their things. Reduce the proportion of adults who engage in no leisure time physical activity. Increasing proportion of schools that require daily physical education. Trying to get adults and adolescents more active in aerobic physical activity. Increasing proportion of children and adults that do not exceed recommended screen time. And again, it's just all the way down to elementary school, increasing physical activity and outside activity away from TVs and screens and computers. That's the goal, the 2020 goal. Okay, so physical activity has multiple benefits, improving your mood, reducing risk of cardiovascular disease because the heart is being exercised. The heart is a muscle, so it reduces cardiovascular risk. Strengthening bone and muscle. That's very important as people get older, especially females, and even the younger females if they're on certain birth controls with progesterone only, like a Depo shot or something. So it's that impact. The impact, walking, jogging, those type of things impact to strengthen the bone and the muscles and decrease risk of osteoporosis, increase bone density. Prevent and reverse some illnesses is a great reduction in risk for diabetes mellitus. It reduces the risk for developing it. It also helps to produce better control of diabetes. So osteoporosis, cardiovascular, and diabetes are huge factors. Improve stability, reducing the risk of falls. So you can see where that's really important in all ages for fall reduction. Physical activity versus exercise. I try to tell people physical activity is body movement produced by skeletal muscle and contraction. Increase energy expenditure. We need to get up and moving. Exercise is planned, structured, repetitive, purposeful. It's improve and maintain our fitness. So I tell people just get up and move, park further in the back of the parking lot, walk to your mailbox, park further, and walk when you don't have to drive. Be physically active, and exercise is a planned things. There are activity tolerance is part of your assessment. Type and amount of exercise. Can they perform their activities of daily living without difficulties? Activities of daily living, bathing, washing their face, brushing their teeth, getting their clothes on, being able to do elimination and clean their perineal area, be able to feed themselves, activities daily, brushing your hair. Okay. Next slide. Isotonic versus isometric. Be able to distinguish the difference between those. Isotonic is dynamic, where isometric is static. Isotonic is you're moving, like jumping around, increasing that muscle tone, you're swimming, you're doing aerobics, you're riding a bicycle, your joints are flexing, blood is pumping, your heart rate's going up, your cardiac output, supplying that blood is increased. Isometric, it's static. It's strengthening abdominal gluteal quadriceps, like doing core strengthening, Pilates, where you're not moving, if you're not moving out the joints, maybe some yoga, doing endurance training. It's excellent for endurance training. It's weightlifting, pushing against things, pressure against a solid object is isometric. Aerobic versus anaerobic, which I mentioned on the other. So the aerobic, you're using those large muscles, you're increasing your cardiac output, and you measure effectiveness aerobic with two things, with your talk test or target heart rate, which I'm going to go over. Anaerobic is the muscles don't have enough oxygen, so they use anaerobic. These are produce energy for very short time. It's in weightlifting or sprinting. It's for endurance training, your anaerobic and isometric. These are just information, just understanding the difference between moderate and vigorous. The biggest on the top here, I love this slide. Moderate, I can talk while I do them, but I can't sing. Vigorous is I can say only a few words without stopping to catch my breath. These are the amount of activity people need, moderate versus vigorous, and the talk test is a great one for that. So you have your target heart rate and your talk test. I'm going to discuss the talk test first. Light, easy to talk. Moderate is you can still talk in short sentences. Vigorous can barely talk or speak a word. That's the talk test to teach people an easy way to go. Am I at light, moderate, or vigorous activity? Target heart rate. Know how to calculate a target heart rate. Maximum is 220 minus the age with a target. I'm sorry, the typo on this slide. It should be 60 to 85% of maximum. 60 to 85%. So suppose you have somebody that is 60 years old. You're going to take your 220 minus 60, which equals 160. So that's the maximum. Your target is 60 to 85% of that 160. So 160 times 0.6 is your bottom of your target heart rate. 160 times 0.85 to get the max. So 96 to 136 would be the maximum heart rate for a 60-year-old. Be able to do that calculation. Exercise is fantastic for your cognitive, to keep everything strengthening the nerve connections. Musculoskeletal, I already talked about. Bone density, excellent for prevention and decrease your osteoporosis risk and decrease fall risk. Cardiovascular, I talked about that, strengthen that heart muscle. It also improves your cholesterol because you're working through and not storing those triglycerides. Respiratory, ventilation, perfusion, which is really important. So remember your cardiovascular risk it actually decreases risk of dementia, decreases your risk for diabetes, decreases cardiovascular risk, decreases fall risk, decreases risk of pneumonia, pulmonary infections. Other things, benefits of your exercise is your GI, gastrointestinal, increase the appetite, but it also increases peristalsis. So the GI benefit is increased peristalsis. Mention metabolic endocrine because it increases metabolism, lowers glucose, so it improves or decreases risk of diabetes. Elimination helps both with the urination in the bowel and even through your lungs, getting rid of waste. Improves our circulation, our lymph system, which is part of our whole immune system. Psychoneurological, it increases our mood, increases the neurosynapses, and helps with cognitive benefits, has cognitive benefits. Ideal exercise duration by age. This is part of the whole 2020 health benefit. You can find this on WHO, World Health Organization, your CDC, NIH, National Institute of Health. So children age 6 to 17, these would be your young children through your adolescent. Know that they need 60 minutes of physical activity daily, mostly aerobic, plus at least 3 days a week of muscle bone strengthening. That's weightlifting, crunches, squats, things where they're strengthening the bone and muscle. They need that impact. 60 minutes a day plus 3 times a week of muscle and bone strengthening. The adults, age 18 or up, it's different. 150 minutes of moderate weekly activity versus 75 minutes of vigorous. That's where you can teach them moderate versus vigorous. They can use the talk test. If they can talk some, it's moderate. If they can't talk at all, or maybe a word here or there, that's vigorous. 150 moderate, 75 vigorous, or they can combine them 2 times a week of muscle strengthening, whereas the children through adolescence, 60 minutes every day with 3 times a week of 3 times a week of muscle and bone strengthening. So nurses, I believe, should model what we say. If we're teaching people to change what they're eating, be more active, taking care of their health, then we need to be doing the same thing. We should teach people self-care strategies, give them information, written information, have them participate in it, have them be able to talk, to evaluate. Active participation is the best thing. Okay, 7B is your oral health. So you want your oral cavity to be free of pain, cancers, lesions, birth defects. Our oral health impacts all of these things. We can get cancers in our mouth. If a mother is not healthy, pregnant, it can lead to birth defects, low birth weights, premature birth. Poor oral hygiene leads to lung diseases. An asthmatic may have more frequent asthma attacks, higher risk of stroke, and of diabetes, all because of our oral health. And when you get into peds and OB, you should learn more about the teeth. Interesting, 30% of loss of natural teeth by age 74. If you look around, you see much higher than that because of poor oral hygiene. Children start losing their teeth between age 7 and 8. Tooth enamel wears away over time. The more decay is increased if we're not getting all the can't think of the word. If we're not keeping our teeth clean, we will wear out sooner. But just remember, tooth enamel wears away over time, making you more at risk for caries and other problems in the teeth. Tobacco, things that are worse on our teeth are tobacco use, whether it's smoking or chewing, dipping, any of that is detrimental to our oral hygiene, our foods that we choose, lack of dental oral care, and lack of fluoride. I grew up before we started adding fluoride to our water. It was during, I think, my teenage years we started adding fluoride. So a lot of people in my generation have a lot of cavities from it. So they added fluoride for years and years, and now it is up to areas, counties, if they choose to do it. Unfortunately, Giants County has chosen not to add fluoride to their water, which I don't understand. So part of education is teaching people about the benefits of fluoride in the water. If they don't have fluoride in the water, especially in the country, if they have well water, spring water, they're drinking water like bottled water, it does not have fluoride in it, and children need to have a fluoride supplement, and we need to use fluoride toothpaste. Importance of oral hygiene: brushing the teeth at least twice a day. It's preferable after all meals. Encouraging being in areas where fluoride's added to the water or have a fluoride supplement. Dental sealants put on the young kids to protect those teeth, and also learning to examine their own mouths and going in for exams to look for oral cancer. Problems: dental caries or cavities. Gingivitis is that red, swollen gingiva or gums. Halitosis is bad breath. Periodontal disease is the gum disease. Plaque. I could not think of the word plaque. It's a bacteria that keeps forming from our saliva, and xerostoma is severe dry mouth that can be a side effect of numerous medications. Do know these: your stomatitis, inflammation of the gums. You want to do better oral hygiene and try to figure out the source for the problem. Maybe the tooth, maybe something else. Glossitis is that swollen, inflamed tongue. It's usually a vitamin deficiency, possibly iron. It can lead to infection, so encouraging oral hygiene is the major for glossitis. Callosis is that cracked lip. The treatment is lubricating and getting an antibiotic ointment because there is a barrier break in your natural skin barrier of the lips and the risk for infection spreading in. Our mouth is so vascular that it can spread right to our heart valves, to multiple places in our body, into our lungs. Okay, so teaching to brush after each meal, a minimum of 2 times a day. You notice here it talks about saliva and fluoride. We have sugars and bacteria in our mouth. Our saliva tries to break that stuff down. We need fluoride to protect. Adequate nutrition. I think that's it for that one. Oral hygiene, oral health for older adults. Risk for cavities because we are losing the enamel. It gets worn away, so it's higher risk. Lack of fluoride water. This is what's crazy. If we don't have fluoridated water during our developmental years, we have higher risk of oral problems when we're older. So that's why the importance of having fluoride, a fluoride supplement, fluoride water in the younger children through the years of oral development of our teeth. Oral care may be difficult due to dexterity problems and dementia. I mentioned activities of daily living. If we're looking at oral prevention, activities of daily living include your ability to brush your teeth at least twice a day. Xerostoma, if they have xerostoma, very dry mouth, you encourage water. Okay, a last section for Module 7 is 7C, normal sleep and rest patterns. Our lack of sleep affects everything in our life: our ability to cope in stress, conserve energy, restore our mind. It can lead to mental issues, increased anxiety, cardiovascular disease. You see that a lot with sleep apnea, a lot of depression, obesity, because we're not getting our normal protein synthesis in our whole Krebs cycle. Increased risk of type 2 diabetes, again, because of metabolism. Can lead to cognitive impairment. Circadian cycle, I don't know where it slipped like that. It's our sleep-wake cycle. We all have a normal circadian cycle. That's why working different shifts can mess us up. You see here, we develop our circadian cycle in our 6th week of life. So it's very important where melatonin is released naturally during certain periods, here during our normal time that our body wants to sleep. So we have 4 stages of sleep. Just remembering there's only 3 of those stages are non-REM, 1 is REM. REM is simply rapid eye movement. So REM sleep is when your brain is active. You'll see the eyes moving under the lids. Our heart rate can go up. our body is actually relaxed and we're very immobile, flaccid at that time, but the brain is active. During your non-REM sleep, everything slows down. Our temperature goes down, our heart rate and blood pressure go down, our breathing rate goes down. So most of our sleep time is in the non-REM sleep, and then we have a period of REM sleep where things get a little more active. So during non-REM is when everything is slowing down. It is important to have both parts of the sleep for our mental health. Our sleep restores our normal levels of activity. We have our protein necessary for protein synthesis. If you think about it, our protein synthesis is needed for us to heal, and protein synthesis is needed to break down those amino acids that we need for our Krebs cycle, which is our whole production of energy. Inadequate sleep leads to irritability, poor concentration, trouble making decisions. Here, impaired cognitive function, poor concentration, poor decision making, slow reaction times, poor performance. So it affects everything. Adolescents. Know this slide. Sleep deprivation and sleep problems in adolescents. Evidence when you're evaluating if they have difficulty waking in the morning. Can't say, oh, that's just a typical adolescent. If they're falling asleep in class, they're having more and more trouble staying awake, trying to drink more caffeinated beverages, trouble completing assignments, they're very irritable, anxious, angry. That means they're having a problem with sleep deprivation and needs to be an adjustment. Adults that are vulnerable are shift workers. Welcome to nursing. You will be working shifts. People that do a lot of traveling with high stress, depression, chronic pain, long hours, multiple jobs, and obviously a parent with a newborn suffers from sleep deprivation. Sleep in older adults. The need to sleep, note this, need to sleep does not decrease with age. Although they may have more difficulty with sleep, they have disturbed sleep, earlier bedtime and wake times. They need still the 6 to 8 hours of sleep, although they may be impaired. So the more impaired, they're going to have a greater decrease in their cognitive function, higher risk of falls, higher risk of dementia, and all kinds of other problems. Although this need for sleep does not decrease, so education is important. So if they're sleeping 5 hours and they say that's normal, that is not normal. It will negatively impact their health. Other things that affect our sleep is irregular morning or nighttime schedule. So it is very important. The first teaching you are going to do with somebody that is having a sleep issue is help them to establish a routine. That is the very first step. Exercise is important, help with sleep, but it should not be late in the day because that'll decrease their ability to sleep. Very important for them to have routine and start their measures to relax before bedtime. Night shift workers will not sleep as well because of the circadian cycle and because of the light that affects us, multiple things. So they will suffer from sleep deprivation. Other things, emotional stress, stimulants, alcohol, diet. Weight gain, obesity decreases our sleep, our productive sleep. Weight loss improves our ability to sleep and our restfulness in sleeping. Smoking, teaching them not to smoke at bedtime, near bedtime, because it will impair their level of sleep. Sleeping well, sleep hygiene. I call it sleep hygiene. It is very important for nurses to teach sleep hygiene, eating healthier, balanced meals, decreasing alcohol, not to have alcohol in at least 3 hours before bedtime, because some people drink a glass of wine thinking it helps them sleep. It actually impairs their REM sleep, so it is bad to drink alcohol within 3 hours of bedtime. Increasing exercise, again, that needs to be earlier in the day, not within 2 to 3 hours of bedtime. getting regular sunlight is needed to help with our sleep. It helps with our vitamin D. Regular sleep schedule. We need a regular wake up and going to sleep time. Caffeine is okay in moderation and needs to be good 10, 12 hours prior to sleep time. Set your bedrooms for success. Having your routine, having a cool room temperature, having things in a certain place, just making it routine for your sleep hygiene. And that is the end of this module.